Hello everyone and welcome to PHAMCAST. I'm Margaret Wallis Duffy, your host, and today I gotta tell you my heart is full and I'm beaming with excitement because today we kick off a special series near and dear to my heart on the show because as a registered massage therapist, a proud one for 33, almost 34 years, I feel very strongly about elevating our profession, about bringing them into the integrative health model. And today we get to kick off this new series called Beyond the Table, how massage therapists are shaping integrative health. You know, as an RMT, I know firsthand the powerful role that massage therapists play in prevention, in recovery, and in empowerment. Massage therapists don't just treat muscles. We educate, we listen, and often become the bridge between traditional and integrative care. This series is going to shine a light on incredible leaders within our profession who are redefining what it means to lay hands on, not only to heal, but to lead. Today, I'm joined with one of those leaders who I get to call also a friend, a colleague who I admire, Leanne Monaghan of Staying Alive Fitness, who will bring her unique approach and collaborative care. Together, we can explore how massage therapy continues to really evolve and why it's such a vital role in the preventative and integrative health model. Leanne, welcome to my table.
Oh, Margaret, thank you. I am so honored and privileged to be here. So thank you for the opportunity. Thank you for being a trailblazer. I mean, heart to heart.
Well, you know what I always say, and you believe this, that inspired leaders want to inspire leaders, and together we learn and grow from one another. And that is what the preventative health movement is about. It's not only all of us helping everyday Canadians learn how to be the CEO of their health, but it's also about breaking down silos and bringing healthcare professionals from all disciplines together to learn from one another, to grow from one another, to get better outcomes for our patients. And to me, that's been one of the most rewarding parts of this movement as the founder of a preventative health movement, month-end movement, because clinicians that wouldn't otherwise necessarily connect or wouldn't think to refer to, that is happening. And this time we get to kick off this series with you. How fitting. You've been in the profession for 20 plus years.
20 plus years, yes.
And really think like I do beyond your treatment table and really looking at, although as a proud massage therapist, what we can really do, the role we can play in this integrative model. So let's start by telling everyone at home your story. Why are you a massage therapist? What brought you there? And then we'll dive a little bit deeper into that whole integrative philosophy.
Oh, whenever we were prepping for the show, and I'm thinking, oh my goodness, the first question Margaret's going to ask me. And honestly, Margaret, I was not called to be a registered massage therapist. I wasn't. I had just gone through a divorce and taken some time off, and then I was starting to get the pressure, like I've got to figure out a career choice. I had been in the horse industry before, rehabbed racehorses, you know, taught, trained, all of the things. And I'm thinking, okay, what's the next move? And one of my friends said, you know what, Leanne, you would be a really great massage therapist. And I thought, oh, well, that sounds interesting. Now, I had never even had a massage before in my life, right? And so it was mid-August when she said that to me, and I quickly researched out what it looks like to become a massage therapist. We had to enroll. In those days, you had to take a little course before you actually got into massage therapy school. So I looked at the massage therapy schools from the lens of how does it fit into my custody arrangement. So I didn't go on the best. And you know what? Within 2 weeks, there I was sitting in my class, and I was in massage therapy school. And you know, Margaret, it was the most beautiful divine moments one of the most beautiful divine moments in my life, because unbeknownst to me, within 30 days, I was diagnosed with cervical cancer. And so here I am, single mom in school, and I have this cloud over my head. And I was in the right spot at the right time because we were getting massages twice a week. We were learning about hydrotherapy, castor oil treatments, all of the things. So everybody banded together, and all of my treatments were based towards healing. And then, of course, that's when I got into visualization and everything else. So because of that experience, and that's now why I'm so passionate about what it is that I do, because going through that experience, I could see how massage therapy was key and pivotal in my healing, and of course all of the education that goes along with when we go to school.
Indeed, and that's extensive, which a lot of people don't realize just how extensive the board exams that we
Yeah.
go through and how extensive it is. It's really interesting that you share that story, and I'd known your story, and I'm glad you shared it so vulnerably, so thank you for that. What's interesting is that I'm very similar in that I too fell into massage therapy because I was going, to Waterloo, University of Waterloo in kinesiology. Many of you that follow me with PHAMCAST, I've shared my story: 10 surgeries, 4 bowel obstructions, a lung collapse, a fecal transplant.
Yeah.
I had severe endometriosis, but I, in those days, didn't talk about it because I was in excruciating pain. It wasn't being validated. And so I had to leave university in the 3rd year to then figure out, to go get treatments for endometriosis, and ended up going to see a massage therapist who in Waterloo. And the way they treated me, from the assessment that they did, to the care that they gave me, to the way they listened, to the connections they made to other practitioners, at a time where I, like you, was very vulnerable physically, mentally, emotionally, and spiritually, it was a game changer. So I too thought, maybe I should look at massage therapy. It's a jump from kinesiology, wasn't far. I knew I wanted to do something in healthcare. And when I looked at massage therapy and dove in, I saw the future. I saw this 33 years later.
Right.
It wasn't that way 33 years ago. My own family thought I was hugging a tree and howling at the moon. What do you mean? What is this massage therapy? And I saw it differently, from a lens very differently, long before. And now look where we are as a profession. Do we still have a lot of work to do? You bet we do. But similar to you, it changed who I was as a human. It showed me how it helped me. And I craved, as a clinician, as a science-based person, to want to take that knowledge and give what I received to someone else. And so here we are, 33 years later, and why I sold my clinic, 45,000 patients in my database, 90% doctor referral. I heard your clinic is very successful. You get that from passion, perseverance, education, and commitment. And that's why we're doing this series. So thank you for sharing your background, because no matter where you've come from, if you're a massage therapist watching, we know we have the best profession on the planet because we can connect all the professions together. That's what we've done for 33, I've done for 33 years, and you for 20 in our profession. So let's talk about that a little bit more in terms of your philosophy. As a massage therapist, we look beyond our treatment room walls. Yes, we clinically work with the musculoskeletal system, the nervous system, but every system in the body. But we also work with the mindset and the psyche, and we're taking care of people. Unlike other professions, there are few that have a half an hour to an hour one-on-one with someone in healthcare, to listen, to observe both physically and emotionally, and to be there to support them.
Yes.
How do you see your philosophy as a massage therapist and fitting into the integrative health model?
Well, I love that question, because I always say I'm where clinic meets spa meets intuition. So what I mean by that is we have the clinical background, we have the schooling, the assessments, all of the structure as a massage therapist.
Yes.
Then the spa part of it is I want my clients to have that experience. So you've been into my treatment room. It's very calming. I love being in there. It's beautiful. So I want to create that experience so that they can relax more, because not everybody has had a good experience with being touched.
For sure.
So I want to have that right out of the gate, that they're, comfortable, relaxed. And then the intuitive part, and this is the part where it doesn't get spoken about a lot, but I feel like this is a good place to start. So I've got the structure of, the massage therapy. We've got the client now relaxed and trusting, and they're in this beautiful space. And then I get to work within that framework, and my approach is very intuitive. It was a game changer for me when I took one of the courses. I think his name was Marty. It was called Deep Esalen Massage Techniques. And I'll never forget, he was from Big Sur. He was like this old hippie type guy, and it was so cute. And I'm thinking, oh, that's interesting. He's not even a registered massage therapist. But anyway, it was a great course. But what that did is it slowed me down, that I began to listen to the tissue. Because as you know, tissue holds memory, tissue holds a story. And if I would be locked in just the structure of it, then,
and the clinical nature
and
of it.
Exactly, that I would miss a whole lot.
Absolutely.
And that's what I was missing when I first started out. And then when I took this course, then that's where I get to play. That I mean, and I'm saying that in a professional way.
Of course.
And so a lot of it is intuitive, and I do hear stories.
You know, the body's intelligence is never ceases to amaze me. And I know that even the conventional medical community is recognizing this. The mind and body are connected. And as you just said, our bodies are our house for our emotions. Our tissues store trauma, emotion, experiences, good and bad. And over the course of time, insidiously, it can lead to dis-ease or disease. And what I love about what you're saying, Leanne, and I couldn't agree more, there's a lot more that goes into a massage therapy treatment done by a professional who truly is that, a professional. From the minute someone picks up the phone and calls in, what they're holding in that, and the courage maybe to even call, because as you said, touch is a very powerful thing. It needs to not be taken lightly. You never know what someone's bringing to your table that day. But then to layer that with the clinical assessment skills, and then the testing that we can do, and then the actual treatment plans, and all of that is really important. That's how I built my career, but you are so right. When we as clinicians can then also recognize that person on the table is a breathing human being with emotions, with a story, and then bring that to it as well, as you said it, with intuition. The tissues tell the story.
Yes.
And in doing that, and I'm going to write a book one day, and stories from my massage table. I'm sure you have many. It doesn't matter the shape, the size, the background of a person, their socioeconomical class. Emotional releases happen on tables because our bodies are intelligent. And when you're in a safe environment with someone you trust, releases can happen, and they are unbelievably powerful, both from a mind and body and from a healing perspective with disease. And we've done this with work with, whether it's with people that are suffering with cancer, whether it's headaches, post-surgical. What a privilege. And thank you for bringing that up in such a way that I think a lot of, I'm going to boldly say this, I think a lot of massage therapists forget that aspect, that privilege we have to honor someone's mental and emotional well-being while also taking care of their physical well-being. Important, isn't it?
Oh, hugely important. Yeah.
So tell us a little bit more, from your perspective. I know you do a lot, and I love this about you. So you not only are a massage therapist, your practice also has a gym. Exercise and weight training is going to be critically important. And then this big and very important piece, the mindset piece, which is often the thing, it's the start that stops us, and it's here that prevents us, I truly believe, from healing. Can you speak a little bit to that as well?
Oh, I love this question. What I say to, first of all, is getting back to basics, right? Mind, body, spirit.
Yes.
And how they're all connected, and how massage therapy can be the bridge between each one of those.
You bet.
Right?
You bet.
So let's use me as an example, talking about the mindset. So picture it, single mom, here I am in school, just recently got my diagnosis. And I started to then change my mindset. I didn't go into fear. I did a little bit, but...
How human of you.
Yes, exactly. Yes.
How human of you.
But I thought, okay, first of all, you got to think about your why. So I wanted to be able to be there for my two boys, and now I've got grandkids, so that's even, the spillover of that. So that mindset of anchoring into, okay, if I can keep my why forefront in my mind, then I know the body will follow, because the body follows the mind.
Yes, indeed.
It's not the other way around.
No.
And when you start to recognize where you have shortcomings in your mindset and be open to change them,
Yes.
And it doesn't just happen like overnight, but slowly, bit by bit, unless it's an emotional impact like what I had. So I had to go on to the fast track of, changing the mindset. But as I did that, and then, the beautiful thing about being in massage therapy school, you can visualize. So
Yes.
I was able to visualize healthy tissue because we were learning about it
Exactly.
as I was going through it.
Yes.
So visualizing that beautiful, healthy tissue. And then, of course, all of my classmates were so incredible. So when we were massaging, there's an intention that they set before. Yes, they're having their hands on my body, but the intention was to help her heal.
Oh, you're making such a powerful point, I have to interject. So yes, the intention that we bring to a treatment, and I also want, which I know you mean this too, the intention that ourselves, when we go to do anything, so if you're going in for a massage, you're going for an IV therapy drip, whatever you're doing, you're eating, what intention are you placing on what you're doing? It is incredibly powerful because we're all vibrating particles. Everything
Yes.
we do can be changed, and we don't see the incredible power of the mind, the energy that it has. And energy medicine is the next, it's medicine 3.0, which I'd like to say, welcome to the party 30 years later. Back then, we had to quietly talk about this in the back rooms, right?
Oh,
As a
yes.
massage therapist, because
It's
it was
like,
woo-woo.
It was woo-woo, and it's like, oh my gosh, I can't talk about it because, I'm not
People
going to
won't
get
be credible.
Exactly.
Your doctor won't refer to you because they're
Yeah.
going to think you're doing this woo-woo
Woo-woo.
thing.
Yeah.
It's science at its cellular level. And
Yeah.
we as clinicians understand that because, as you so beautifully said, we are the bridge to the gap of those three things: mind, body, spirit. Because energy can't be created nor destroyed, but we do have control over the way we morph that energy.
Exactly.
And I love the way that you are saying that. And so now you're doing, and this is what you integrated all the work you do, which we're going to talk more about on the show. And that's to me the power of massage therapy, isn't it?
It is. It is. Like, I feel that it's a privilege and an honor to carry that title. And it goes with me in everything that I do.
Exactly. Me too, which
Yes,
is
of
why
course.
we are here launching this series off today on PHAMCAST, looking at Beyond the Table, massage therapy, the heartbeat of healthcare. Stay tuned because we're going to be right back with Leanne. We're going to dive in more to look at massage therapy, the role it plays in integrative health, and so much more. Stay tuned. We'll be right back at PHAMCAST.